Right. So typically I'll start treating if someone needs improvement in extension and elbow extension or getting the arm all the way out straight, lying on their back. But then if specifically their problem is that they can't get it all the way straight in a more weight-bearing position, like if they're doing yoga or if they are doing push-ups or wanting to do planks for a long period of time and they can't get the arm all the way out straight, then I'll actually progress to treating in this position. So now I have Jen here, and I'm just going to kind of passively allow her elbow to bend and then straighten it out. And so I'm feeling the back of that elbow, that olecranon process, again, how it kind of wants to fit into that. There's a little fossa there, and it should actually get relatively straight there, and it doesn't. All right, so I'm feeling, is there soft tissue on the front that doesn't want to lengthen or open up, or if the bone doesn't want to go into that fossa. And I think in this case it is that that bone doesn't want to go in the fossa. So I'm right on the back of that bone, and I'm just kind of feeling what direction doesn't want to go into, and it's more in this direction here. So I'm going to actually block her into that position and then let her knee bend or her elbow bend just a little bit. Let it come just straight back towards me, just the elbow, good, and then come straight up there. Okay, shift your weight forward just a little bit if you can, Jen. Let it bend just this tiny bit right there, and then back up. Yep, so that's going to be the motion that we're going to do. Try not to let the elbow go out. Think about it going straight back towards your hip. There you go, and then back up there. Perfect. So that's what we're going to do. So I'm going to come on it, block it in that tight direction, and let that elbow bend just a little bit, and then straighten it out. Good. And again, bend just a little bit, and straighten it out. Good. Another thing that I could have her do is think about flexing her hand down into the table. So she could flex the hand down into the table. Good. And that engages my fingers also. And let it go. And then let's try to straighten that arm all the way out. Good. Right there. And then flex the hand into the table. And let it go. And that's just a good option that we have. Let that elbow relax just to see how well we can get that elbow into extension. That's one option. The other option is it may be more limited at the end of that bone of the upper arm into the humerus, and I could also treat that as well. In her case, it's more that olecranon or the elbow bone right on the back.